Hello, guys. Tonight we're going to talk about the Glasgow Coma scale. All right, the Glasgow Coma scale, okay? All right. So, the Glasgow Coma scale, I just want you guys to remember EVM. So, eyes opening, verbal response, motor response. So, you have to remember these three categories, especially if someone comes in with a brain injury. If someone has any type of indication of increased intracranial pressure, you always want to, rate the patient's level of consciousness using the Glasgow Coma scale. So eye opening, verbal response, and then motor response. Okay, so here are some examples. So just imagine if you were to take care of this patient. And you notice here how his face is, he's going to have some type of injury because it's not only the fall, the impact of the fall, but this guy is using him as leverage also. So he's applying pressure to his head. So situations like that, that's when you would use the Glasgow Coma scale. So you would look at the eye opening. Verbal response, is this client, does he have incomprehensible sounds, inappropriate words, confused, or is he oriented? And motor response, does he have abnormal extension, abnormal flexion? Does he withdraw from pain, localizes the pain, obeys commands? So you have to keep all three in mind because remember, if he is less than 8, Glasgow Coma scale less than 8, that's very severe. That's an indication of brain injury. All right, moderate is 9 to 12, and mild is greater than 13. So we're always using this because we're trying to figure out, okay, if there is some type of brain injury, to what extent. So you always want to make sure that you're using this scale in those situations. Okay, so let's take a look at this gentleman. All right. Eyes opening, either to pain, to voice, or spontaneous. Verbal. None, incomprehensible, inappropriate, confused, oriented. Motor. None, abnormal, abnormal flexion. Well, abnormal extension, abnormal flexion. Withdraws from pain, localizes the pain, obeys commands. All right. So remember, we have to do this because severe, less than 8, moderate, 9 to 12, greater than 13 is mild. I want you to also take a look how many points. It's just 1 point. So if this patient is a 9 and if he decreases to an 8, he's classified as severe brain injury. Okay, same thing here. From 13 to 12, moderate brain injury. So as a nurse, we're always using our Glasgow Coma scale because we need to alert the doctor right away. Even 1 point could put the patient in a different category. All right, so this, just pretend that, maybe this was an accident, or just look at her feet. All right. So we're always looking at posturing. We would look at her arms also, just in case she's not verbal. So you always want to assess eye opening, verbal response, and motor response. Okay. Just in case if you are, you're a nurse and you want to provide some care, this is something that you can let, the paramedics know upon arrival that you did the Glasgow Coma scale. And you assess eye opening, verbal response, motor response, and you can give them a number. Because remember, severe, Glasgow Coma scale less than 8, moderate, 9 to 12, and mild is greater than 13. So, we'll let the paramedics know, let the physician know if there's some type of brain injury occurring. Same thing here. This guy or the physician, they're going to do the Glasgow Coma scale. eyes opening, verbal response, motor response, because they need to make sure that they react to any type of brain injury right away. All right. So remember, only 1 point decline could, be the difference between mild, moderate, and severe. Okay. Indication. Also, we use it. We will constantly assess this little guy. Okay. Eye opening. You can kind of see his eyes are opening. We want to make sure to pain, to voice spontaneously. All right. Verbal response. Incomprehensible, inappropriate, confused, oriented. And then motor response. None, abnormal extension, abnormal flexion, withdraws from pain, localized to pain, obeys command. So these are our interpretations of findings. We have mild, moderate, and severe. Remember, 1 point decline could be the difference between mild, moderate, and severe. All right, Glasgow Coma scale again. Eyes opening, none, to pain, to voice, spontaneous. Verbal response, none, incomprehensible sounds, inappropriate words, confused, oriented, and motor response. This is when we're looking at posturing. None, abnormal extension, abnormal flexion, withdraws from pain, localizes to pain, obeys command. Now, this is one way that you can remember. I found this an image. So just look at eye opening, 4. Okay, 4 eyes. 1, 2, 3, 4. Right. So none, to pain, to verbal command, spontaneous, E. And then V is 5. None, incomprehensible, inappropriate, confused, appropriate. And then the motor response is 6. None, disseparate, decorticate, withdraws, localized, obeys. So this is something that you can use also. Okay, so look here. Abnormal extension, abnormal flexion. Disseparate, abnormal extension, abnormal flexion. So this is a very good tool that you can use also. So you can, always think 4, 5, 6, and then disseparate, decorticate, withdraws, localize, and obey. So this is a very good image that you guys can use also. All right, guys, that is it. All right. And I will see you guys on Friday. We'll start with, what are we doing this week? Friday, I did today. Oh, cancer. Friday is cancer. All right, guys. See you later.